What's it like to be alive?
Oh, wonderful. I'm just grateful to be here talking to you, really. Good morning, Britain.
Oh,
It was a nasty ordeal, but grateful to have been on the receiving end of it.
I mean, it's such an awful disease in so many ways. One of the worst things, Ralph, is that you're not able to see your family, your loved ones, as you're fighting for your life. How difficult was that part of this, where you were facing the biggest challenge you've presumably ever had, and yet you couldn't have your loved ones with you?
I wouldn't really know. It's because I was unconscious for 10 days. But I think it was harder for them that they are unable to see me. But on my part, I didn't know what was going on. I knew that when I was taken to the hospital, I was unwell. And when the team of doctors and nurses and the ITU specialists told me that I was going to put on a medical coma, in my heart, I knew that I was going to survive. I knew that I would make it. It's because I was in the right place and going to ITU. I know them, and I had an outstanding care from them, and they validated it. So on my part, I'm just really grateful.
I'm sure you are, Ralph. And you make a very good point that, of course, in your position, you didn't necessarily know what was going on around you. But the thing is, Brenda, in your position, you absolutely did, as Ralph's wife and the mother of your 3 children together. You both tested positive at the same time, didn't you? Ralph then, you know, it became extremely serious. You recovered relatively quickly. But were you able to spend any time with him in hospital?
I was on isolation that time because I was also COVID positive. So that was really the worrying time. And I felt really devastated because I felt so helpless, thinking that I'm COVID positive. I couldn't see him. I couldn't even comfort my children. So what I did is I was down on my knees praying, asking my family, my friends, my colleagues to pray for him to pull through. So during when he was in coma for 10 days, I was wide awake day and night, thinking that, you know, on the a bit of me was saying he might not pull through it because, you know, coronavirus is a new thing to us and we know little thing of the disease. And he is in a critical condition. Looking at him, he was really bloated. He was vomiting, and there was a time that he needed quite a lot of oxygen requirements. So I was just holding on my faith that God will do a miracle and God will bring him back to us.
Well, Brenda, God did perform a miracle, but God...
Yes, thank God for that.
But God got some help from Cindy Lee and from Dipen. Cindy Lee, let me talk to you first. It must be so gratifying for all of you on the front line of the health system.
Hi.
You know, good morning to you. It must be so gratifying when you see people now able to talk about their experience, who've actually survived, and knowing that you've played a part in that.
Yes, it is. It's absolutely wonderful. This is such a positive story to share, and we obviously all in this, you know, together, you know, as a team and as a nation. And this is something for our whole team and our whole hospital to, you know, celebrate at this time. And as negative as this time is, it's actually a very positive time. And to see Ralph and his wife there is absolutely wonderful.
And Dipin Rai, you also cared for Ralph. You're caring for so many people at the moment, you know, where the outcome is tragic. It just, every time someone pulls through, it must be the most enormous relief. Is there a moment at which you know and you just, the relief washes over you that, yes, this is a life saved?
Yes, we have a very difficult situation and a difficult, challenging time. But when we see patients coming out from the hospital, going to the right direction, we're trying to discharge them to the ward, and we feel very happy. We feel very like a boost for the so we can come another day and work.
And Brenda, that moment, you prayed to God, you got wonderful help from the team, including Cindy Lee and Dipen. And that moment when you got Ralph back and you and your three daughters, they're 16, 14, 11, what was the moment like when you could be with him again?
Well, we were all exalted. My children, they were so happy when they saw their dad back after 13 days. So, and that was the only time as well that I saw them, because they were, we have isolated them up in the attic. So we haven't seen them for like 20 days. The minute that Ralph started self-isolating, so we have contained them up in their bedroom.
And Ralph, the moment that you got home must have been extraordinary. You've now got two of the people here who helped get you home. What would you like to say, finally, to Cindy Lee and to Dipen?
I am overly grateful. Oh God, I'm being emotional now. Well, to the whole of the Imperial College Healthcare NHS Trust, really.
It's
you know, when you're a nurse, you know, you see these things all the time. You see patients struggling and being helpless and losing it. You experience it as a practitioner, I suppose. But when you're on the other end of the spectrum, when you're experiencing it, it's a life-changing experience. And I thank Brenda for taking me to Charing Cross Hospital, because it's a home for me. And when you are unwell, of course, you would like to be surrounded by the people that you know, and they are a family to me. I thank intensive care unit at Charing Cross Hospital for saving my life and bringing me back to my family. And hopefully I should be able to join you again as a frontline staff, and the rest of the Imperial College Healthcare NHS Trust for sending words of comfort to Brenda and to my kids. That really helped a lot. There was this message from one of our directors saying that Brenda showed it to me just yesterday, say that, you know, that Ralph is part of our family and we have got to bring him back no matter what. And I thought that was very, very sweet. So for everyone, A&E, Medical Admission Unit, and for the rest of my family at Imperial, I am truly grateful to be here, and I hope to join you again sometime soon.